We're also going to ask you the details about how your neuropathy affects your life. In other words, what makes it better, what makes it worse, if anything, what types of treatment have you had, what types of treatment have you not had, what do your other physicians have to say. If you have brought medical records with you, which we strongly recommend, we'll take a look at those and really just try to gather as much detail as we possibly can, because as we've spoken about, Paul, the most important thing in peripheral neuropathy is to understand that many times it's a diagnosis of exclusion, and we want to be sure, as I tell patients all the time, what you don't have. So that really is the most important part of the initial assessment. And you can see it's very casual. Crystal and I do the entire process right in this very room, and we look forward to seeing you. Paul, what I'd like to do next is to talk about some of the treatments that are commonly employed in the neuropathy clinic especially. There are some unique things that we do to help patients recover from peripheral neuropathy, and we don't want to talk about some of those therapies. What we have on the desk here is a combination ultrasound electrostimulation unit. This is very commonly used for patients who suffer from peripheral neuropathy, but may also have a component that affects their back or the hip, for example. What a lot of patients don't understand is that when you have peripheral neuropathy, let's say you have neuropathy in your feet, secondary diabetes or chemotherapy, if you have a pre-existing back problem, as most adults do, unless that back problem is addressed, you're not going to get nearly the recovery from the neuropathy that you could unless that's addressed. So commonly, Crystal, as my medical assistant, will be performing some ultrasound or electrotherapy stimulation to the hip, to the lower back. It's very painless. Crystal will simply apply some gel. Actually, show me how you would do an ultrasound, Crystal. Let's say, for example, we're treating a forearm. It's very simple therapy. There's some warm gel, which is simply a water-based gel. She applies the unit, and basically the ultrasound head is performed in a very circular motion. And what that does is to create some changes in the tissue beneath to help reduce muscle spasm, control pain, and so on. It really sets the stage for a good neuropathy treatment. This, of course, might be useful in somebody that suffers from carpal tunnel syndrome or other neuropathy in the hands. One of the most important advances in the treatment of peripheral neuropathy has been the use of what's called the rebuilder, or a dual-frequency nerve stimulator. Now, a lot of people, as Crystal will tell you, come into our offices who've been treated at other facilities that have what are called TENS units, or sometimes EMS units. Those are totally different animals. The rebuilder, as a dual-frequency nerve stimulator, is a very unique device. Comes in a couple of different models. This happens to be the professional unit that's commonly used in the office. Many patients, or chemotherapy patients in particular, will co-treat with a unit of their own at home. And what I'm going to do today is have Crystal just show you a little bit about how we commonly apply it in the clinic. It's a very painless application, but something that does work wonderfully well. And as Crystal is applying the device, in other words, she's going to set me up as if I was going to be treated, I'll tell you a little bit more about it. So Crystal, I'm going to let you take it away.
Okay. All right, I'm going to put the gloves on.
Okay. And we're using the conductive garments today to demonstrate how we would treat a peripheral neuropathy of the hands. Neuropathy of the hands commonly occurs in patients that have diabetes, patients that have undergone chemotherapy. There are several different ways that the rebuilder neurostimulator can be applied, and one of the common ways and the easiest ways to use it is to use these metal impregnated garments. It's very important to understand that you can only, to get an effective treatment, you've got to use the real McCoy. There are imitations on the market. It's very important to understand that, because this is a very delicate instrument. The best treatment you can receive is going to be by using only original equipment. There is a large degree of variability in conductivity from one manufacturer to the other. Rebuilder Medical in particular are real sticklers about inspection. I've been in the facility a couple times. I've met the inspectors. I know the work that they do. So it's really important. This is not something you're going to go purchase from somebody who really doesn't know what they're doing. So what Crystal has done basically is to put the conductive garments on. What she's going to do next is allow us to make some connection excuse me, with the neurostimulator itself. And what she's done really is to just slide a rubberized conductive pad underneath the garment. And what this is going to do is to allow the very, very gentle current from the machine to come through. Crystal's now connecting the garments to the unit, and basically what she would do is to either teach you how to turn the unit up yourself, as we commonly will do in the clinic, right? Or sometimes even let the patient turn the unit on. So I'm going to have you go ahead and turn the unit on. And that's okay. That's okay. No problem. But basically what happens is you turn the unit on. It is putting out two electric signals simultaneously. It's putting out a low frequency, 7.83 cycles per second, very low current stimulation. And the low current stimulation actually mimics the nerve's natural waveform. And it's that replication of the nerve's natural waveform that allows patients to experience decreased pain, decreased numbness, decreased tingling, burning, and so on. Now, the first time in the clinic, how long might I use these, Crystal?
15 minutes.
15 minutes, right. 15 minutes if you're comfortable. One of the things I really like about this particular form of neurostimulation is that if a patient ever gets uncomfortable, all they need to do is this and it immediately disconnect it. So it's very, very safe. It's very, very painless. And most patients say it feels wonderful.
Yes.
Yes. And if you've ever had pain and you know how miserable you can be, this is a great device for the neuropathy patient. One of the key components to helping a patient with peripheral neuropathy and many painful disorders recover is what is commonly called manual therapy. Now, chiropractors sometimes will call it an adjustment. Physical therapists oftentimes will call it joint mobilization. I prefer the term mobilization myself because basically what it implies and describes is the type of movements that we'll be applying to a patient that suffers from chronic pain. Now, there are several different types of chiropractic adjustments, some of which you may have experienced before or seen administered. One of the most important things to understand is that peripheral neuropathy is a different animal, so to speak, clinically, and it does require a different skill set. So very commonly, the techniques that the chiropractic physicians, medical physicians, and physical therapists that we train work with or what are called the axial distraction type of techniques. And those are techniques that are basically designed to open the spinal canal and do some stretching very gently. And what I want to demonstrate here is how we may start a treatment, Paul. Commonly, the patient will be placed in a very comfortable position, a very, very comfortable treatment table. And the first thing I'll often do after assessing the patient is to use what are called the SOT blocks or wedges at strategic locations under your hips. And this is designed basically to take some stretch into the lower back and elongate the spine. The principle here is to try to just open up the vertebra, open up the spinal canal a little bit by just gently stretching and allowing your body weight and gravity to do the work. You can see it's a very, very painful, very, very painless technique. It's administered for a period of time that could last anywhere from 3 to 8 minutes or so, depending upon what might be going on. The other types of techniques that are commonly used in the peripheral neuropathy clinic would be perhaps massage techniques to the calves, sometimes the feet, the hips, and so on. But one of the most important things that your neuropathy doctor or therapist is trained to do is axial distraction of the spine. And one of the simplest ways to do that is with the patient positioned comfortably, where the doctor or therapist will very simply contact and apply some very, very gentle stretching maneuvers like this. And really, when this is combined with the other specific modalities that we use to treat peripheral neuropathy, such as mobilization of the hips, mobilization of the feet, and so on, it can really have a big impact upon your recovery.
I want to thank you all for watching Health Naturally, and I want to thank Dr. John Hayes and his assistant Crystal and their office staff for being a part of the show and helping us all learn more about neuropathy. If you want to know more about neuropathy, Dr. Hayes has written a book, Beating Neuropathy. Again, thanks for watching Health Naturally.